Hello, my name is Dr. Jon Evans and I am with ProTailored Physical Therapy here in Fort Wayne, Indiana. And I get a lot of patients that come into my office asking about the popping of their joints, if that's okay, if it's bad, all that good stuff. So I'm going to address all these questions. So when someone walks in, they say, hey, is it okay if my shoulder's popping when I raise my arm over my head, or when I lean over to tie my shoes, my knee pops? We're going to look into that. So let's first look at what causes the cracking and the popping. To be honest with you, there's a lot of theories out there, but they're still trying to figure out truly what's going on. There's a lot of theories, but not a lot of facts. The first theory is that you have gases in your joint. So you've got nitrogen, oxygen, and carbon dioxide. And when you stretch that joint really quickly, those gases release, and that's why you hear the pop. And then if you wait 20 to 30 minutes, those gases will get reabsorbed back into your joint, and that's when you can pop it again. So the second theory is that you've got different soft tissue structures that go across your joint. So something like a tendon. A tendon attaches your muscle to a bone, and when you move your joint, that tendon can glide over that joint surface and cause a pop, a crack, or a snap, which can be another reason why you feel a little unsettled or you hear that noise. The third theory behind the popping or the noises when you move your joints is having rough surfaces on your joint. So say you're having some degeneration of your joint and you don't have the right soft tissue between your joint surfaces, that can cause grinding and cracking and kind of an unsettling feeling. So let's move on to the second question. Is it okay if my joints pop? To be honest with you, it's okay. Most of the time, I'd say the majority of the time people come in here and ask me that question, it's completely fine. There's only a couple scenarios when it's not good. And one of the first scenarios is if you're having pain and cracking, or vice versa. When you get a pop, you have pain. It's typically not a good thing. So I'd go get that checked out. The second scenario is if you feel grinding between your joints when you move. Typically it means you're getting some arthritic changes, and you'll feel like this kind of grinding feeling. It doesn't really necessarily feel like a pop, but you may hear something that sounds kind of familiar to a pop. Go get it checked out. It's not going to get any better. Majority of the times it means you're getting some pretty serious arthritis in a certain area, and you need to do something about it. Let's move on to the third question. Is it okay if I pop my joints? Meaning you, the viewer, popping your neck, doing it on your own. I'll be honest with you, most of the time it's just fine. I would suggest that ultimately if you do too much of anything, it's not good. But I pop my back maybe once or twice a day, every couple days, and I'm doing just fine, and I would encourage my patients to do the same. Now, I would not encourage you to pop your neck, your back, your elbow, whatever, multiple times, every couple hours, every minute of the day, because ultimately too much of anything is not good. And if you do it too often and too much, with too much force, you can get something called hypermobile joints. And what that is really, you can compare it to a rubber band. If you overstretch a rubber band repeatedly, it's going to lose its elastic properties. So when you stretch it over and over and over again, it doesn't go back to its normal shape. The same thing happens with the tissues around your joints. If you keep stretching it with a bunch of force over and over and over again, then it's not going to go back to how it used to be. It's going to become hypermobile, and it's going to bend in a lot more directions than it should, and then you're going to have to come see me. It's great for my job security, but not good for you. So don't do it too much. Too much of anything is not good. So what it comes down to, popping can be caused by a number of different factors. And number two, popping is normal in most cases unless you have pain with the popping and it's consistent. If you're popping your joints all the time, stop doing it, or else you're going to have to come see me. And if you are having pain with the popping, you can come see me here in Fort Wayne, Indiana. We're located at the intersection of Union Chapel and Coldwater on the north side of Fort Wayne. You can visit us on our website at www.protailored.com, or you can call us at 260-739-0300. Thanks.